eyes were steadily deteriorating. I felt that I could see better on some days than on others. I went to play golf and then couldn't focus on the ball, which really annoyed me. But then in the evening, when the light wasn't as good, my eyes were really quite poor. I mean, I wore glasses, but even so they were varying a lot, and that was what annoyed me so much. I came here and I met Simon Madge, and he immediately put me at my ease because he's just got such a professional manner, so I felt good about that. And he spent, I can't remember how long, but a really long time explaining what would happen. And he made a lot of checks in my eyes because he had to decide whether I could have these lenses or not, because they're not suitable for everybody. Mr. Madge put in multifocal lenses, which meant that I don't need to have any spectacles at all. I had plenty of time to ask any questions that I needed to ask and to think about other things that had flown out of my mind when I first came into the hospital, which tends to happen because one always feels a little bit anxious to start with. But I felt by the time I left at the end of the consultation, I really knew what was going to happen and I was perfectly at ease. I certainly had enough information to achieve an informed decision, and there was no pressure put on me to do one thing or another. It was up to me. So I had the first one done early last year, and I came into the hospital and I spent about an hour having eye drops put in every 10 minutes or so by a lovely team of nurses who, again, made me feel quite happy about everything. Before I came to the hospital for my first appointment, I was rather concerned because I had heard from other people, oh dear, it's awful, you have to have an injection straight into your eye. So I asked Mr. Madge about this when we were discussing things, and he said, no, that wouldn't happen. And he was able to do the entire procedure merely with my having eye drops. I didn't have any injection or anything unpleasant given to me at all, actually. I went in to see Simon Madge, who was waiting with his team, and I was put into a chair rather like a dentist's chair, and then it went right back so that I was reclining almost flat, like as it were on a bed. And he brought a machine down very close to my eyes, which was a big magnifier, so that he actually worked by looking through this magnifier. I held a nurse's hand all the way through, just in case I had concerns or felt anything. And I remember I didn't need that because it was reassuring to have it, but I didn't feel any discomfort at all throughout the process, which I think took about 20 minutes. After I had had both eyes done, my vision was really fantastic. After 48 hours, I think I drove 3 days after having each eye done without any difficulty. I did notice that although I felt my eyes were very good, they continued to improve. I suppose as I got used to it, my brain got used to having these very different eyes. So the improvement continued. After I went home, I was told by Mr. Madge's secretary that I could have his telephone number, and she gave it to me, and if I had any problems at all, I was to ring him straight away. And I thought it was wonderful that I had that reassurance. I have recommended to all my friends to have this procedure. It's not actually suitable for everyone to have these multifocal lenses, but I think having one's cataracts done earlier rather than later is really important. I would certainly recommend Mr. Madge and his team because they looked after me so beautifully.